Hello, Dr. Sanchez and fellow classmates on the Performance Management Class 5380 in the spring of 2019 at Amberton University. My name is Pamela Thomas, and today I'll be discussing reviving the performance appraisal process at a nonprofit organization. Introduction. I'll cover the graduate project objectives. I'll present the purpose of performance management at a nonprofit organization. I'll review the existing performance management system that's in place at the Gulf Coast Center, which is my nonprofit organization. I'll review and discuss different performance evaluation systems. We'll review and discuss the pros and cons of each one. And then we'll make a recommendation on a performance evaluation system for Gulf Coast Center. The objectives of this project are to examine the previous and current performance management system at the Gulf Coast Center, to assess the organizational objectives and goals for the new direction under the new leadership, to ensure the organization's goals and objectives are aligned with employees' objectives and goals, and overall to revive and resurrect the performance appraisal review process at this organization. Expectations of this project are to propose a new performance appraisal system based on the strategic goals of the organization and in consideration of the contextual factors that may influence the nonprofit organization. We'll also identify the benefits of the proposed customized performance review process recommendation. The organization that I've selected is the Gulf Coast Center. The Gulf Coast Center is a nonprofit 501c organization. It's a community outreach program serving the Houston and surrounding areas. It was established in the 1960s under the Texas Mental Health and Mental Retardation Act by President John F. Kennedy. The Mental Health Mental Retardation Act introduced an innovative new concept for the financial and local support for citizens affected with mental health and mental retardation issues. This program's objective is to serve the needs of individuals that are in need within their own communities. Therefore, their programs reduce the number of people that are sent to state facilities for care. The Gulf Coast Center is one of 39 community centers in the state of Texas, and it continues to offer substance abuse recovery services under the auspices of the Department of State Health Services. The Gulf Coast Center provides the following services: adult mental health services, child and adolescent mental health services, intellectual and developmental disability services, adolescent recovery programs for mental illness and mental retardation, substance abuse programs for teenage and adults, veteran support services, mental health and youth health training on how to provide care, and HIV support services for the citizens in the greater Houston area. The Gulf Coast Center's vision and mission is combined. They state their vision is to provide better community health care and promoting healthy living. Their mission is to provide accessible, efficient, quality services to support independent and healthy living to the people that they serve in the greater Houston and Galveston area. Their mission is to earn the confidence of the citizens of Houston and the greater Houston area in Harris County so that the Gulf Coast Center is recognized as an exemplary model for social services in the community that it serves. The Gulf Coast Center value statement. They list humanity. The Gulf Coast Center values people foremost by serving individuals and families with care and compassion. The Gulf Coast Center values excellence. They value the pursuit of operational excellence by striving to gain efficiencies, decrease costs, and enhance service delivery through innovations. The Gulf Coast Center values accountability. It values achievement of an exemplary standard of accountability for the individual employees and their collective performance. The Gulf Coast Center values loyalty. They value the crucial role which family members and other natural support systems play in the effective treatment of the citizens and clients that they serve. The Gulf Coast Center values teamwork. They value collaboration to efficiently maximize the utilization of the resources and to improve the outcomes of patient care. The Gulf Coast Center honors, values united and uncompromising resolve as they steadfastly safeguard and evolve their work environment to uphold education, responsible self-direction, and collaborative coaching. The Gulf Coast Center values you. They value their commitment to build and strengthen a partnership that benefits the needs and the values of the community that they serve as a whole. The organizational structure of the Gulf Coast Center is a tripartite board comprised of a board of trustees made up of executive management team, members from the private sector interest groups, and a planning advisory committee. This collective board of trustees manages the hired and appointed CEO. The CEO has their own professional staff in the form of Director of Operations, a Chief Financial Officer, a Compliance and Accountability Director, and this collection of management is over the direction and processing of the Gulf Coast Center staff. The issues that the Gulf Coast Center is currently facing and risks associated with these issues are: due to a lapse in consistency in employee performance reviews, they are at risk due to the government requirements to demonstrate efficiency and could be subject to a finding in an audit. The risk associated with Gulf Coast Center also is related to a change in the HR management team. In 2017, the Gulf Coast Center changed the HR management staff. They brought in a new, much more aggressive HR team to shake things up. And in this change, they've implemented some new processes. New performance standards and new procedures were implemented. Also, they've implemented a change management strategy. A part of the strategy is to link the goals of the organization directly with the departments and the employee objectives. Nonprofits operate on limited resources from government grants and other receivables. Therefore, it's very important that all resources are managed efficiently and effectively. It's also important that they maintain the proper documentation and standards in all areas. Also related to the Gulf Coast Center as a nonprofit, they are less equipped to compete with private sector and public sector organizations as far as salaries due to the restrictions in the funding. So they are currently facing an increase in attrition in experienced resources. Also, the change in management, change in resources has increased or created an environment of distrust in the new management system and fearing that their evaluations going forward are going to be biased due to the management change. So these are some valid risks that the Gulf Coast Center is currently facing surrounding performance appraisal. Why is performance management important for a nonprofit organization? It's important for transparency in the organization's overall performance for the stakeholders. Again, it's government funded, so they have to give an account of how the resources are being used, both capital and human resources. They also are required to meet legal requirements, so complying and having very structured processes in place is important. Performance management is important for a nonprofit organization to improve employee performance and engagement, as in any corporation, whether you are a nonprofit or for-profit organization. They also have a mission to increase service quality and to be recognized as an exemplary community service organization. It's also important for the organization to align the organization's goals and missions to the employees' performance goals. Having a disconnect could leave room for error and employees' efforts not counting toward the growth and development of the organization. Performance management also provides useful information to document employees' weaknesses and strengths for training purposes. It also helps clarify job responsibilities and expectations based on current standards. Performance management versus performance appraisal. Simply stated, Agüenes defined performance management as an ongoing process of identifying, assessing, and expanding the performance of individuals and teams, and aligning the performance with the strategic goals of the organization. Performance management is also including the design of jobs to interlock with the department and the teams, and the evaluation of performance of employees performing those jobs. Performance management is usually top-down planning and top-down defining on how employees will work, what goals will be pursued, and how the employees will be evaluated. With performance appraisal, it's a key element of performance management, and it involves establishing performance standards and identifying appraisal-related behaviors. Performance appraisal is a summative, retrospective look at how well employees perform, and it's used to apply rewards or sanctions or penalties for poor performance. Performance appraisals is held at a certain point. It can be annually or quarterly, or if you're really efficient, more often. But performance management is ongoing. Performance appraisal includes input from the employee in a collaboration with the manager on defining goals and how performance will be measured. In the performance management process, step one is to communicate the standards and expressing expectations of what you expect from the employees. Performance appraisal works best when there is a clear understanding and agreement about what an employee is expected to do and how they will be graded. Employees should be given a clear description of what is considered as poor, average, or exceptional level performance. They need to know all of the levels and standards of how they'll be graded. Some organizations use job descriptions and job tasks as a starting point for establishing the expected task. The second step is gathering information about performance. The supervisor or manager who is responsible for evaluating an employee's performance can use different methods to collect information regarding an employee's performance. Some common methods for gathering information are personal observations, comparing performance against a job description checklist, gathering feedback from other managers, team members, customers, or perhaps even getting input from the employee that's being evaluated. Another step of the performance management process is performance assessment or evaluation. Performance appraisal is a process that involves evaluating the employee's performance, that is determining whether their performance met the objectives or not, and to what level did the employee perform. It also includes providing feedback about that performance. Ideally, meet face-to-face with employees to discuss results from the performance evaluation. This discussion should convey the basis and factors on how their performance rating was derived. It should also provide an opportunity for the employee to share their feedback on how they view their own performance and give feedback related to management. Ideally, the meeting should include a discussion on new goals, training and development, and the next step going forward. Performance appraisals can be conducted in different ways. Here are just a few. One option for appraisal method is the 360-degree appraisal. This method involves getting feedback from the employee about the employee from different individuals that interact with him. Feedback can be gathered from the direct manager, customer, peers, and perhaps the employee. Using a multi-source feedback can give a well-rounded view of performance, and it can also decrease the influence of biases of a single rater. Another option for performance appraisal method is the paired comparison approach. This approach compares employees in the same job groups. Employees are rated in comparison to each other, and the highest rated employee represents the standard by which all others are compared. The attributes evaluated can be their technical skills, interpersonal skills, adaptability, etc. There can be many factors to be evaluated. Another method that's also very popular is the management by objectives. This approach is an interactive form of appraisal that involves the employee and the manager collaborating in setting goals. By involving the employee in the goal-setting process, they are more inclined to perform better and view the process as fair because they are involved. Another appraisal method commonly used is behaviorally anchored rating scale. This method is a combination of narrative technique, like an essay evaluation, and quantifiable techniques like a rating scale. The scale range is defined by points ranging from low performance to extremely high performance. Essay evaluation is another method, and it's very judgmental because it's a narrative done by the manager in a form of an essay that identifies the different strengths, weaknesses, attitude, behavior of the individual. This one can probably be one of the most cumbersome and time-consuming forms of appraisal. And then there's the rating scale. The rating scale method involves setting predetermined objectives that employees are expected to meet. That's usually done against a job description. Individuals are then rated on a scale of 1 to 10, or any range of 1 to 5, it varies by corporation, by their supervisors or managers based on the performance criteria. The areas of evaluation, again, can be on job task, their work attitude, their teamwork, productivity, other factors related to their performance. Steps that should be considered before proposing a change or implementing a new system. When the new HR management team arrived at Gulf Coast Center, they took the following steps as fundamental. They did a review of the current performance management system to identify what was working and what was not working. to salvage the best pieces of the process. They then went on to review all of the job descriptions and updated them as needed. As another safe method to ensure proper documentation that the people doing those jobs were aligned properly, the employees were required to reapply for their current positions based on the updated job descriptions. They aligned the job descriptions to the organization's mission and value statement. They also defined new processes for setting employee goals and objectives. They also define how performance will be measured based on the new objectives of the employees. They introduced the new system, the new way of evaluating performance to the staff and management. They provided training to the manager's employees, and they implemented a pilot. They gathered feedback and revised the process as needed. And some of the findings were, although the initial pilot, employees felt the ratings were biased because they had used to seeing a job standard that never changed over the years and their ratings were consistent. However, this time they varied. So the next thing that was looked at by the HR team was also determine and redefine how the performance process and appraisals were used at the Gulf Coast Center. Here were some known attributes. Pay increases were not tied to performance reviews. That didn't change. Merits were given to everyone when there was a budget available. So, although you could have high performance, it didn't necessarily mean that you would be promoted or receive a pay increase. It was all contingent upon budget availability, and it was usually given across the board to everyone. Performance reviews were typically handled on an annual basis, although, again, recently there had been some lapse in being consistent. Perhaps the previous management saw it was way too inefficient and cumbersome due to the increased workload. And previously, the performance was based on their old job descriptions, and they were using a rating scale method for evaluation. Employees were used to seeing a checklist that resembled their job descriptions, ranging from 1 to 5 as a rating scale on how well they performed. The HR team did a comparison of the rating scale method versus a possible option, which was the management by objective method. And she looked at the pros and cons of each. The rating scale, the objectives previously were aligned to the organization's missions and goals, previously stated. The MBO, or management by objectives, can also, and is also, objectives are aligned to organization's missions and goals. Under the rating scale, the objectives were defined by the organization's goals and job description. Under the MBO, the employee and the manager could work together and define goals based on the actual work and write them in a SMART method, identifying areas where they specific, measurable, attainable or agreeable, realistic, and timed. Under the previous method, the objectives were inflexible and occasionally unattainable, depending on the workload due to tight resources and caseload. Up under the MBO method, it allowed feedback and coaching given on a regular basis with the management team. The rating scale was easy to use. A manager could simply mark 1 through 5 on the rating scale, and what was found, which was probably a factor in the employees being used to seeing the same grade, is managers tend to grade in a very linear way, staying close, not going too high or too low in marking behaviors. In the MBO method, Employees are given and receive feedback on their performance, giving them a voice in the process. In the rating scale method, the rater can be biased because you're using a single rater to evaluate the employee. Under the MBO method, if they are bringing the multi-source feedback, input can be given from manager, customers, peers, or other members of the team to give feedback about the employee. The MBO method also was adding a component of feed forward, identifying areas of strength so that moving forward, they focus on what the employee did well and building on that. Under the previous rating scale method, the employee was really not given much feedback in the process. They were given the option at the end of the review to ask questions, but by that time, the process was done. The MBO method focused on development or training set based on areas that needed to be improved going forward. Suggested option for reviving the performance appraisal system at the Gulf Coast Center was management by objective. For the following reasons. It allowed the new HR team and the management team to define the company's performance goals based on the mission and vision, and to cascade those goals down to the employees, but allowing the employee and the manager to set realistic goals on how they can contribute toward meeting the corporation's goals and objectives. It also gave them a clear understanding on how they were going to be evaluated. The performance review process was an opportunity for the manager and the employee to review and discuss performance and give feedback to the employee in the form of moving forward and coming with a development plan. Additional suggestions made for improving the performance appraisal process was, and they did, incorporate the feed forward approach, provide employee training. The new process gave them more transparency to the employee in the process. Employees had a voice in the process. They also implemented an appraisal process that was given more often than annually because they made it less formal. They also did something that was very unique, and that was to encourage managers to work closer and build relationships with the employees as a form of introducing the leader-member exchange theory, to build closer relationships as a way of coaching and giving feedback more frequently. And they also allowed the employee and managers to write SMART objectives. The evaluation process using the MBO method with SMART objectives now gives the employee and manager to work together on creating objectives and goals for the employees with realistic, attainable goals that are time-bound, that are agreed upon. It also gave the manager an opportunity to still use a form that was simplified. Instead of going with the scale of 1 to 5, they are now identifying areas where the employee shows a development needing, performing satisfactorily, where they showed strength and leadership, and still arriving at a grade. And it also included a comment section, so the employee and manager could give a summary on the employee's performance during that period. Additionally, as a part of the new way of working process, the HR team worked with local managers on introducing the LMX management theory to improve employees' receptiveness to the new performance appraisal system. It also addressed the appraisal reaction. Distribution justice is a positive reaction to performance appraisal, which influences employees' perception of fairness. Employees are more receptive to change in the process. It addresses the procedural justice. Involving the employee in the process by giving them a voice, they're more inclined to accept feedback and results, even if they don't fully agree with the rating. It also helps influence interactional justice. And this is an element that relates to how the employee felt the appraisal process was handled, whether it was done respectfully or professionally. All of these factors can help improve how receptive employees are to the new system, and also to make them more receptive to the new performance appraisal process. In doing a review of different articles and literature on performance appraisals in public and private sector, there were several studies conducted on performance management and appraisal in public sector, but not enough have been conducted on the direct impact of performance management in the nonprofit organizations. Most studies conducted were focused on performance-based monetary rewards, but nonprofits are not driven by pay increases. They're focused on intrinsic rewards, such as increase in responsibility or recognition. So the importance of how do we compensate or invigorate employees' enthusiasm when money is not the way to influence them. And that is one reason why we are recommending the leader-member exchange theory, and also the change of strategy and involving employee in the process. Extending research on how to improve the processes for organizations with resource constraints. Again, the nonprofits are government funding, so they are not as competitive as a public or private sector company. So you have to really be more creative about motivating employees and their performance. These are some of the limitations of the information I found in researching nonprofit organizations. Recommendations for future studies. I recommend more studies to be conducted in the area of performance management and performance appraisal in nonprofit organizations. I recommend a study from the stance of how human resource professionals can integrate employee engagement in the performance management strategy. Future studies could also investigate the differences in HR structure in relationship to the implementation of performance appraisals, specifically related to the variations within nonprofit subsectors and size. I also recommend extension of research to evaluate how to improve the process for organizations with resource constraints and various contextual influences. In conclusion, this researcher states that by improving the performance management system and the appraisal process, you can improve the performance of an organization and the employees, or at least have a positive impact on the employee performance. By incorporating the leader-member exchange theory, management can have a positive impact on employees' performance and their perception of the appraisal process. By including employee feedback in the goal-setting step and giving feedback and coaching, an organization can also improve the employee's perception of fairness in the appraisal performance system. References used to perform and evaluate the impact and the benefits of maintaining a performance management system and performance appraisal system in a nonprofit organization.